Good morning. It's great to have you with us today for what I hope is going to be our last virtual meeting. As we all know, navigating through the pandemic has been a challenge for all of us. It's been especially difficult for those who are suffering from substance use disorder, or as we know it, addiction. Hopefully, we've made our way through the worst of the pandemic. Hopefully, we've made our way through the worst part of this when it comes to people suffering from substance use disorder and the isolation that the pandemic has brought us. Still, as we look back and we're starting to see the numbers that are being presented, we've got the CDC has told us between May of 2019 to June of 2020, about 81,000 people died from substance use disorder. But what they are also telling us is that we're going to see 100,000 deaths. Think about that, 100,000 deaths across the country over the last year throughout 2020. It by far would be our deadliest year. And it's so sad. If this were any other problem, this would get a lot more attention. But once again, it's stigma that kind of controls a lot of the things that happen with regards to this disease. But there's some real positive news. On Tuesday, I was joined by our city manager, Eddie Augustus, Reverend Janice Ford, Chief Stevie Sargent, Chief Shaw, Chief Martineau, Chief Wayner, and some other people, recovery people, with regards to our first year results of the critical incident management system. Pam Kelly and Sean Verano of Kelly Research Associates have been invaluable in this. And they're going to be here today to give us a better look, a deeper look into the numbers and why we have hope. Now, launching such a program has got its challenges to begin with. But when you do it in the middle of a pandemic and a nationwide lockdown, it's particularly difficult, especially because a critical part of the program involves knocking on doors, in-person visits by overdose survivors and plainclothes police officers to offer services. And unfortunately, throughout the year, we weren't able to meet face-to-face with every overdose survivor. But of the overdose survivors we contacted, now this is amazing, 52% of them accepted treatment or other services. It's such a reason to hope. Another 9% were already seeking treatment on their own. And only 26% of the people declined the offer of help. But for the people who went there with compassion and empathy, who knocked on the door, who offered services, no one got a door slammed in their face. There were conversations that had, discussions that were had, conversations, and maybe with the prospect of the hope of revisiting this and trying to get the help that they needed. Now, these are real encouraging numbers. Another statistic worth noting that throughout Worcester County, of the 961 overdoses in which Narcan was administered, 96% of those individuals survived the overdose. Narcan was administered at 80% of the overdoses police and other emergency people responded to. Now, these numbers tell us that the continued use of Narcan, coupled with in-person visits with the survivors, is saving lives and will continue to save lives. The police chiefs at our conference to a person all praised SIMS as an important tool in our collective fight. And it's a great example how when we work together, we can get anything done. When you don't care who gets the credit, we can do so much. The police chiefs especially like the fact they could learn through SIMS if someone in their county overdosed, for example, on the North Shore, the South Shore, the Cape, because they could then go knock on that door. And I want to thank Kelly Research for developing SIMS in all of our 60 police departments for making it work under historically difficult circumstances. In addition to Kelly Research, we have my friend and our great Congressman Jim McGovern here today, who's going to provide an update on the federal response to the opioid epidemic. Congressman McGovern has helped our efforts to get federal grants, including $1.2 million awarded last year for recovery coaches throughout the region who are going to be knocking on the doors in some of our smaller communities. This is just good government. And it isn't the first time Jim McGovern's helped us. He helped us with the Hal Rogers grant. He's helped us bring in a couple of $1 million in grants, but really people who are just suffering from a horrible disease. He's been a tremendous partner in our efforts to end addiction. He's shown real leadership on this issue, and I can't thank him enough. And we truly appreciate everything that he's done for us. Now, our battle isn't going to be successful unless we all work together as that team. And I'm happy that Congressman McGovern is on our side and has been such a great partner in the fighting with us shoulder to shoulder to end this scourge and erase the stigma addiction. His help with the grant funding and his compassion and empathy it's second to none. In his leadership on it, again, it's second to none. Along with our other police chiefs, Chief Montminy over in Uxbridge and Chief Bolton, Nelson Bolton, who are in this meeting with us as well. Everyone's out there, door to door, shoe leather, banging on doors, asking people are most vulnerable if they need help. And we know when we treat this like any other relapsable disease, like heart disease or diabetes, we're going to win this fight. And we know. When we were down in the Prescription Drug Abuse and Heroin Summit that was held virtually this year from Atlanta, at least 85% of our speakers said we need to remove stigma. Dr. Collins from the NIH, Nora Volkoff, the secretary with regards to addiction services at the NIH, tell us we have to treat this. We have to treat these human beings like the people that they are, our brothers and sisters, sons and daughters, nieces and nephews. So I want to turn it over to Congressman McGovern. We're lucky to have him here today. Thank you so much, Jimmy.
Well, thanks, Joe, and thank you for your incredible leadership and the leadership of your team. I want to thank also everybody who's on the Central Mass Opioid Task Force for their dedication on these very important issues. I want to thank you for caring. I want to thank you for thinking out of the box and being innovative, and you're helping to save a lot of lives. I also want to thank Liz Haddad for all of the great work that she does as the task force coordinator, and again to everybody on this call. While overdose deaths across the country were already increasing in the months preceding the pandemic, in the past year, overdose deaths have reached a record high. The overwhelming majority of these deaths stem from synthetic opioids made with illicitly manufactured fentanyl. Despite the slight decrease in fatal overdoses in the city of Worcester over the last year, sadly, there was an overall increase throughout Worcester County, and this reflects the trends that we're seeing nationwide. The staggering number of overdose deaths highlights the need for essential services to remain accessible. We also need to be making sure that we expand prevention and response activities. We've had a lot to focus on during this pandemic. When we consider all of the work that we've done to fight this country's opiate crisis, the recent backslide is devastating. There's no doubt that during the pandemic, more people were experiencing anxiety and depression. And one of the ways that people cope with depression and anxiety is through recreational drugs. And for those who already struggle with addiction, this also increases relapses. Today, while you'll hear about some of the innovative steps Worcester County is taking to cope with this crisis locally, I'd like to just share a few things that we've been doing on the federal level. On March 11th, President Biden signed the American Rescue Plan into law, which took unprecedented steps to help our nation recover from the impacts of the COVID-19 pandemic. It provided money for vaccine distribution, support for small businesses, relief for working families and those still looking for work, funding to get kids back to school safely, and much, much more. The American Rescue Plan also invested nearly $4 billion into addiction and mental health treatment grants. This includes critical funding for substance use disorder prevention and treatment grants, mental health and addiction training for healthcare and public safety professionals, and behavioral health workforce education and training. We also included an additional $7.6 billion for community health centers to address behavioral health disparities in underserved communities. So these resources will help us rebuild the country after one of the most challenging years in our history. But the COVID stimulus bills are just part of a long journey ahead. Narratives about addiction have shifted over time. And in recent years, those who struggled with substance use disorder were often perceived as degenerates and criminals, when instead we should have examined these challenges through the lens of compassion, as the district attorney mentioned. Addiction is a disease. It's not a moral failing. And we must end the stigma around those seeking treatment. While some people who struggle with addiction are also diagnosed with mental health disorders, others may develop mental health problems related to their drug use. Whatever symptoms appear first, it is essential to treat substance use disorder with the care that it deserves. There is no shortage of negative attitudes toward people who struggle with opiate use disorder. And unfortunately, this stigma makes people who are struggling less likely to come forward to seek help. This in turn leads to poor health outcomes and creates a self-perpetuating cycle. So that's why the work of this task force and its members is so important. Collaborating and sharing best practices in the best way to reduce substance use disorder and the adverse impacts that it has on our community. So we must continue to find innovative solutions to get people the help that they need. It can and it will save lives, as you all know. And I would like to end on this. At a time in Washington when some of my colleagues aren't able to come together to create even a bipartisan commission to investigate the terrible attack on the Capitol on January 6th, initiatives like this task force, give me hope. It's an example that we need to follow here in Washington. In this group, I see a wide array of government entities and concerned individuals who are focused on solving problems that have brought far too much suffering to our communities. And I look forward to continuing to work with all of you. It is hard in a political climate that is so polarized, to find common ground, but we have to. And on this issue in particular, it is vital. This is about saving lives. It's about protecting the lives of members of our community. It's about saving and protecting lives in our own families. So I want to thank all of you for having me here today. Please don't hesitate to reach out to my office if you plan on applying for any of the federal grants that I mentioned or that the district attorney mentioned. We're here to help in any way possible to make the connections with the relevant federal agencies. If you have ideas that you want to have amplified here on the federal level, please let me know and we will work with you. But I appreciate all those on this task force. And I'm really proud to be with you this morning. Thank you. I'll yield back my time.
Thank you so much.
Yeah.
Thank you so much. Were we doing questions, or do you have a minute for questions if there are any?
Sure. Yeah, if there are any.
All right, Liz, do we have any questions for the congressman?
We don't right now, but if people have questions for the congressman, they should use the Q&A function. The bottom of the, type them in and I'll read them out.
Jim, the grant you did get us, I just want to talk a little bit more about the 1.2 million. There's a lot of towns that, just don't have the funding. So that 1.2 million allows the recovery coaches, a lot of people have been through the addiction themselves to go knock on the door, but we wouldn't have that but for that grant. So literally that money just saves lives. And also, as you know, addiction is a family suffers through this, not just the person addicted. And it really alleviates a lot of that family suffering. And that's just good government. Thank you so much for that. Liz?
Hey, we do have a question. Is there a website, Congressman McGovern, that lists all the grants that are available?
Yeah, there are a bunch of websites depending on which agency is providing the grants. But maybe what we can do is try to compile a kind of one-stop shopping list, if you will, that we can make available to you and you get it out to everybody.
That sounds great. I'll work with your office, Congressman. We'll get the list out and we'll send that out in our next newsletter.
Right. No, because I think that's important. And look, I mentioned some of the upticks in funding in the American Rescue Plan. The reason why that's important is because there's a desperate need out there, and sometimes when there's not enough resources, the competition for a limited amount of federal resources becomes incredibly intense, and a lot of communities that need the help from those grants don't get it. So I think we're making it a little bit easier, and quite frankly more likely that some of this federal money can flow down to the to our local communities. But we'll try to work with you on a kind of a one-stop shopping list, and people can see what applies, and we will work with you on that.
Great.
That'd be great, Chairman.
I think that's the only question. Anybody else for a question?
if they do. Jimmy, one of the other things that, like the Hal Rogers grant, working with a conservative member from Kentucky,
Right.
you know, with a liberal member from Massachusetts, just, it's amazing the way that barriers are broken down because of this problem.
Yeah, I mean, look, I always tell people you don't have to agree on everything to agree on something. And whether your politics are on the left or the right, you know, or in the middle, I mean, I think we all understand that this is a crisis. And that it is important that we come together and provide the resources so that we can support what works. You know, one glove doesn't fit all. And I think one of the things that I think you all have mentioned over and over and over, I mean, you got to do what works. And you have to approach this in a compassionate way. But what works maybe in Worcester County, you know, may not be what is the best approach in New York City or in Mississippi or wherever. So I think the importance of these grants is to be able to support the innovation and the consensus that develops at the local level. And again, this is one of those areas where I think it transcends politics. We just need to make sure that we're a partner with our local communities and our DAs to make sure that, you know, we are helping you do what you know what works. And I just close with this. You know, I was thinking before I got on this call of all the friends that I have known over the years who lost their lives to substance use disorder. I mean, people with incredible futures, people with wonderful families, people who just were incredible individuals. And, you know, and I think, you know, we've lost out on some really wonderful, wonderful members of our community who have died in this struggle. So, you know, I feel as strongly as ever that we need to partner together and we need to be wind at your back. And again, whatever I can do, I want to be there for you. So thank you.
Congressman, we actually have just a couple more questions. We have a few
Okay.
more, but
Okay.
we could
go
just
ahead.
quickly run through a couple.
Sure.
One
I
of the
noticed those,
questions-
hold on, Liz, some of those are directed, if I can help with that too, Jimmy, we're doing a few things.
Sure.
Go ahead, Liz.
Sure. I guess one of the questions I think is important is, are any of those resources going to those who are addicted behind bars? That's always a big.
Well, we do know that some of the resources
Sure.
as to our prevention measures and the counseling, Pastor Janice is in there, you know, talking to the inmates. We're trying to get reentry. So some of that funding is directly and indirectly. The bulk of it, the majority of it right now is out on the street with recovery coaches. I see there's another question of prevention measures. We've bought a couple of movies. One of them is called This Is Not Drugs, and it's actually down in Atlanta. It was touted as one of the best, if not the best prevention program there is in the country right now. We go in and talk to 6th, 7th, and 8th graders. They take a 15-minute quiz about the morphine molecule. Then they watch a short video about kids who got addicted as early as 12, 13, and 14 years old. Then they take the quiz again. And what it does is it informs them. I love prevention. I know Jimmy does too. It gives us an opportunity to inform them about the morphine molecule so they're not hearing it at a party with this bowl of pills being passed around. And do we get to everyone? No, but we get to a lot of kids and we make them a lot smarter with regards to prevention. So these grants are also going towards prevention measures, recovery coaches, reentry measures. And it also goes to, I saw there was a question about stigma. It goes to stigma campaign and, you know, save, not shame. And we have a big poster board in our office. We're trying to constantly let people know, you know, these are our sons, brothers, daughters, sisters, nieces, and nephews. They're your next door neighbor, and you shouldn't be judging them. We've got to treat, as Dr. Nora Volkov said, treat it like it's diabetes or heart disease. And if someone goes to the emergency room and doesn't leave with a treatment plan in place, now this is coming from a doctor, she said it should be medical malpractice.
So I would just say there's monies that are available for, you know, for the prisons can apply for. There's money for reentry. Some of the monies that are in the American Rescue Act are still trying to figure out what the criteria is going to be. So whoever asked that question, if you have an idea of how it might be used, get it to us, and then we can, you know, check with the agencies here and find out whether or not you might be eligible for some of this money. So if people have some creative thoughtful ideas, I want to hear them. I mean, get them to me so we can, run them by the agencies and figure out whether or not you might be eligible. So, but there are, and I'm not quite sure what the question was, whether prisons can apply or whether there's money for reentry back into, there are monies for that, but if there's something that somebody's thinking about that's maybe I'm not addressing here, get us that information and we can check it out for you.
And we can assist, at the task force, we can assist you getting that information to the congressman's office as well. We're always here to help.
Yeah, if anybody has any questions that didn't ask them today, get them to Liz and she get them to me and we can get back to you.
Perfect.
Okay, Liz, is that about it? And notice we also have Chief Darren from Spencer here, and I want to thank all of our chiefs and all of our today. And Jimmy, I can't thank you enough for being here. Your leadership is second to none on this. You have a big heart. You lead with your heart, and we appreciate it.
Well, let me say hi to the chief too. I represent Spencer. It's a great community. So anyway, but thank you. Thanks, Joe. And thanks to everybody on the call. And again, if anybody has any questions, call me directly. And we can, we'll get right back to you. All right. All the best, everybody. Be safe.
Thank you.
And I also want to apologize if I missed any, chiefs, but all right, these meetings, the hallmark of these meetings is keeping them short. So one of the things that we didn't get into the hard and fast on the numbers, but is the empathy and compassion in terms of removing the stigma on this. And we've all got to continue that fight. We've all got to continue bringing that message forward. People have to tell their stories. As hard as it is, we got to get, like Sam Canoni said at our last task force meeting, we've got to get more people to tell their stories, and that's the way we're going to remove the stigma. And I think what you guys do, giving us these numbers, then the police, what they do with the recovery specialists, what they do, what everyone does collectively, without anyone looking for any fanfare, just going out knocking on those doors, that's going to help remove the stigma, because you've got faith-based groups, recovery groups, you've got government. It's not, people showing up with lights and sirens, and it's, they're asking the question, how you doing? And, do you want help? We can help you. That's the way we're going to beat the stigma. That's the way we're going to beat this. Pam and Sean, you're just great partners. And I thank you for all of this. Liz, I thank you for your leadership as head of the task force. And I thank everyone for being here today. And Liz, this might be a good place to end it. Unless you have any questions or. Okay. Thank you, everybody. We'll see you at the next meeting. Any suggestions you have for us, and bring your friends to the meetings. Bring friends, that are looking for answers. Bring friends with kids, that are right now that have the disease, the substance use disorder. Let them know they're not out there alone. And we partner with everyone, whether it be Learn to Cope, Add Care, whether it be Spectrum, Timmy Rassius with Washburn House, Reverend Talley, and all our faith-based groups. I don't want to leave anyone out, but it's all by working on this together that we're going to get to where we need to be. But the information that you bring us through SIMS is just so invaluable, and it really does, reach over across boundaries. Like Chief Martineau said the other day, this isn't a jurisdictional problem. It crosses boundaries, so our solutions have to cross boundaries as well. Thank you so much, guys.